The increase in respiratory illness across the country, flu and RSV levels elevated while COVID hospitalizations are trending up. ABC News medical correspondent Dr. Darien Sutton is here now with us more. Okay, Dr. Darien, where do we stand with all these viruses?
Good morning. Well, scientists are still working to understand how to predict this virus and these viruses overall in terms of respiratory seasons. We've currently seen a 200% increase in the rates of flu, more than 60% increase in the rates of RSV, and more than 50% increase in the rates of COVID in the last month. A couple of reasons why. It's colder, we move closer, that increases transmission. There's evidence that COVID reduces our immune response, which can make us more susceptible to infection. Vaccine rates, unfortunately, are not as high as we would hope. Approximately only 18.5% of people have gotten an update in their COVID vaccines. And then, of course, we have this new variant that is likely associated with this increased transmission.
All right, let's talk about COVID. COVID hospitalizations are up for the 6 straight weeks now. Should we be concerned, especially with this new variant, that there could be more spread?
Well, the new variant, the JN1 variant, is labeled a variant of interest, but overall there's relatively low public health concern. As for the patients coming in or not coming in with abnormal symptoms, it's very consistent with what we've seen with COVID, but it is increasing. And for context, in November, the rate of this variant was about 3% of the total cases, and right now it's more than 50%. And so that should provide some concern as evidence that it might be more likely to transmit from one person to another, but it's not evading our methods of protection, wearing a mask, washing our surfaces, washing our hands, and then, of course, making sure that we're updated on our vaccines.
Well, this is the time of year you're with all your loved ones. You're still going to be with your loved ones heading into the new year.
Yes.
So what can we do to protect ourselves?
Well, I think if it sounds like I'm giving a forecast, I think in very many ways, I'm looking at it in the same way. You know, when we look outside and we predict the weather and it's going to be raining, we're going to grab our protection, our umbrellas, our rain boots. And we should look at these numbers the same way. When we see these numbers are high, which they are right now, it's raining outside technically, you want to make sure that you have that protection, that high quality mask, washing your hands, making sure you're updated on your vaccines, and always preparing for the highest risk person in the room.
All right, Dr. Darien, thank you so much.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.